I'm so happy to be here. So thank you for every time someone gives an intro of me, I'm always just like, oh my God, I never know what to say. So, and I know I gave you that intro, so thank you for reading.
My pleasure, of course. I mean, it's a sign that you're making it, right? I never feel like we've made it. We're always making it, right? Because there's always another day ahead of us.
I know it's so funny because I guess like back in the day, startup founders would work out of their garage. And it's just funny because this came out of my diary to a Word doc, and now it just feels real when it's in the real world and I'm talking to
Yeah.
someone about it. So in my mind, it's also just the last couple of years of my life condensed into this moment. So thank you.
Oh, my pleasure. Oh, yeah, I love hearing that. As a fellow founder myself, I understand, and I'm already inspired by just what I know about you. I'm looking forward to the conversation.
Yeah.
Um, so please, I read a little bit about you and your journey, just as to
Yeah.
get our imagination sparked. But please tell us a little bit who you are, how you got inspired to start this path.
Yes. So my name is Dr. Varuna Srinivasan, and I am a physician by training. And so right out of med school, I got a job with Doctors Without Borders. So I've been in the field, kind of working with women, delivering babies at 25. You know, when you're in India, it's a low resource country. So you're kind of in it from the get-go. And I think that working with MSF had really sparked that joy and interest in mission-driven healthcare and working in public health. So I moved to the US shortly after to finish my public health degree at Hopkins. And so I guess sort of being in that environment, talking to a lot of entrepreneurs, but also change makers, like gender justice advocates, it was kind of, I felt like everything that I wanted to do was kind of like in a silo. Like it was either entrepreneurship or it was, like mission driven work where you start a nonprofit. And so I kind of followed the nonprofit world. So then I worked with, up until last year, 2 years ago. Oh my God, 2 years ago, I left Planned Parenthood. So I was with them when Roe v. Wade was overturned. And I think that that also kind of sparked this. Again, I wanted to marry the two worlds. I was really interested in entrepreneurship, but also really interested in gender justice and reproductive health. So I guess where I am right now is I founded Fluid Health, which is essentially a marriage of the two.
I love hearing that. Wow, delivering babies at 25.
I know that's what stuck out to you. That's what sticks out to a lot of people. They're just like, you are a child yourself and you're
Well, it sticks out because it's a testament to your character. I'm less blown away by the fact that you did that, but the fact that you chose to do that. And
yeah,
that I think is what really stands out for me.
yeah, yeah.
So tell me a bit about fluid health, and you spoke to the marriage of it. So what is that
Mm.
between exactly? When you're like, okay, I have this experience, I see these issues, things are getting overturned. What is it that you're marrying?
So I am a woman living in an American healthcare system, which I think if anyone is listening, or maybe you even know someone in your life, Hunter, where they have asked you about a doctor's visit, or they've called you to talk about a recent doctor's visit, or they feel like they've been in situations where they haven't really felt believed or affirmed for whatever conditions that they're experiencing. There's a lot of gaslighting, there's a lot of dismissing, misdiagnosis, underdiagnosis. And I think that a lot of it comes into play, especially with pelvic and reproductive health. I think, and as we're in a really interesting time, of course, where abortion rights are being rolled back, gender affirming care is under attack, and so there's these layers, I think, to specific health issues that certain people are facing. But one thing I had also noticed throughout my own journey, especially with being diagnosed with an autoimmune disease, which is also quite common in your 30s, is you're going to multiple doctors they don't really know what's going on with your body. You're just kind of like at your wit's end. And I think it's kind of my own personal experience, but also I think a professional frustration where I think a lot of providers in this system are burnt out. They're not really connecting with their patients, and the patients have to navigate insurance. And especially if you're a woman or you're queer, you're kind of also dealing with this added layer of medical trauma. And so I think that, like I mentioned, I think these are especially true if you're seeking out gender affirming care, sexual dysfunction, anything to do with like gynecological health issues, endometriosis, PCOS, it's just a lot. And so Fluid is a concierge care navigator, and we think that everyone should have access to that level of emotional support when they're seeking out care. And also tying into my public health background, I think different populations seek out help differently. And even though women and queer people are more likely to seek help, they are often burnt every time. I feel like there's this constant cycle of distrust, medical trauma that they're re-experiencing. And so we built this app, which essentially connects people, and our use case is pelvic pain, because it disproportionately affects women, lesbians, and bisexual people. And they go up to 7 years without a diagnosis. And so we designed an app with the framework that people seeking care with specific health conditions need more emotional support. And so our app is live, our MVP is live. We have proof of concept, and we match people with sex therapists if you're experiencing sexual pain, sexual dysfunction, secondary to pelvic pain, and it can be a result of anything. And of course, like as a founder, I think working in healthcare is a lot of it is conversations. And so I'm also manually matching people with providers that they need, but also like, I think especially for us, healthcare is so word of mouth that we trust recommendations based on what another person has said. And so I'm also manually matching people as a concierge with endocrinologists, obstetricians, gastroenterologists. They're not sure where to go for that health information. And so I think it's not just personal navigation. I think it's emotional support, and it's also health literacy. And I think we are tracking a lot of interesting patterns, because I do think that there is potential for an AI-powered care navigator, especially. I think the more that we can learn about a patient and the more support they need, especially in this really busy world, which is also one of the barriers to care, I think the easier it can get to access specialized care.
I love hearing that. And I love hearing the human touch and involvement that you have right now. It's not just this magical automated system. You're going in, you're like looking at their charts, looking at what they're saying, and like,
Yeah.
You okay?
Yeah, I mean, yeah. So I'm not a physician in the U.S. healthcare system right now, and so I'm not
Okay.
actually looking at their chart. But a big part of it
Okay.
is being a friend. I think that's a big part of Fluid is, we recommend doctors to each other. A lot of the people that I'm speaking to often are like, oh yeah, I found my provider on Reddit. Like I was on the subreddit for PCOS
Wow.
or endometriosis.
Yeah.
Can anyone tell me if this doctor is good? And I just, I have a lot of like user calls, and a lot of them are like, oh yeah, my friend told me, I found my psychiatrist through someone else. And so I think
Absolutely.
that's what we're trying to embody, is that trusted, reliant source that you can use to think of us as like a gender inclusive, emotionally supportive ZocDoc. I think that's a really good way to put it.
I love that. I love that. Because it's also, a lot of those platforms that have reviews and stuff, I think they were all of their intentions were originally very good, but then the systems got manipulated by like bot positive reviews and like all this stuff. And then it's like hard to question or hard to know what is actually like a reliable source. So it's very interesting to hear you share about the folks finding things on Reddit, for instance, because that's like, oh, I'm
Exactly.
talking to a real person right now that has real experience, presumably.
Yeah. I mean, I think that we're trying to streamline that patient journey almost, which is the search that they take to find someone. And I think what the traditional healthcare system or a lot of platforms often get wrong is I don't think that they have built for certain populations. They've built it for a very specific, cisgender, heterosexual experience. And so I think it's a little bit more than that, right? So one of the people I was speaking today was like, oh yeah, I started having symptoms. I wasn't sure. I decided to try something on my own. Months went by. They went on Reddit, found a recommendation for an OBGYN, went to, I think they said Weill Cornell website to look for an OBGYN. That OBGYN was not available. They found another one that turned out to be shit because they were just like, they didn't believe me, they gaslit me. And that was a really bad experience. And I had to advocate for myself. And then they just kept searching and searching and searching on Google until they finally understood that they needed to see an endocrinologist for their PCOS. So I think there are several issues here, right? I think there's people that aren't able to find the providers that they need, but they're also not sure what types of providers they need. And they're also not having a centralized place to understand more about their health. And they're also like obviously going to Reddit because they crave that emotional support. So I think we're using all of those parts in when we're trying to build Fluid is like, no, I think we can be that go-to place, especially I think condition-specific care navigation, instead of just being this all-inclusive place, because I think different populations struggle with different things that contribute to disability and poor quality of life. And I think for a lot of women, even though we live longer than men, we live a lot of years in disability as a result of pain, as a result of like autoimmune diseases. And a lot of queer people often don't, trans people especially, like I think like 40 is kind of, their, is kind of, what is the word that I'm looking for? But like, the lifespan doesn't go beyond 40 for a lot of trans people. And I think a lot of queer people also live like poorer quality of life. So I think also like keeping a lot of those things in mind, I wanted it to be more condition specific versus, oh yeah, we'll just match you with any provider. I think these are the conditions. This is who you need to see. Let's connect you. But then here's also what you need to know how you can advocate for yourself.
Yeah. I've heard, I completely understand what you're saying about the trauma of like the system that is built for cis folks, and it hasn't been updated. I mean, plenty of people in my community, myself too, like that's one of the reasons why I found my doctor that I now have been with for 10 years was because my previous doctor was like gaslighting me, never remembering anything from our previous thing. It was like, this is terrible, even shaming me at times. And it was like, excuse me, like I'm out of here. When the shame factor came in, I was like, I'm out of here, But this is not a unique story at all.
No, not at all.
Yeah. So
I'm so sorry that happened to you. Oh my
well,
God.
thank you. I mean, it was a long time ago, and I'm like my doctor is like my sister now. Like I love her. My sister has seen a very intimate part of my body, granted, but not quite like my sister. But you know what I'm saying? The relationship is very like.
I think that's the thing that every single patient remembers the most, right? I think if I have waited 6 weeks to see you and I have jumped through hoops and I'm still jumping through hoops and I get to spend half an hour with you, I want to make sure that I'm getting the most out of that visit. And I want to make sure that you're the right match for me.
Yes.
And I think that's an untapped potential in the market from what we're seeing. I think that's a gap that hasn't been addressed. So that's a big part of what I think is at the core of what Fluid is doing.
Yeah, I love hearing that because it is so important. You're right. It's like appointments are weeks, if not months out. If you reschedule, then you're like, oh my gosh, how am I going to get back in this queue? And like, and if it's not, and if you don't have a good relationship with them, then you're dreading it and you might skip the appointment and then it can get worse. Or
literally.
Like it sounds like you're removing like all these layers of friction for people.
Exactly. Yes. 100%. I'm glad you get it.
Oh, I do. I'm very passionate about this space. So that's again why I'm very grateful to talk to you about this. This isn't my lane, but I am like a strong advocate for what you're doing.
Well, I think but that's the thing. And I'm glad that it's speaking to you on a personal level, because I think that's really what that's why this exists, because I think that everybody has that pain of like, oh, I wish I could find someone, the right person who could understand what I'm saying.
Yeah. What's a myth about healthcare that you wish you could debunk?
I think something that's really frustrating oftentimes is how I think, especially if you are a startup, if you work as a nonprofit, having worked at Planned Parenthood, you are raising funds, or, I worked in like an academic setting at Yale and Hopkins, and a lot of it is grant funding, right? I think in the entrepreneurial world, of course, you can go several ways. But I think for a lot of like mission driven work, it's so frustrating because a lot of the myths there are mission and profit are mutually exclusive, that you have to like give up some part of your mission to scale rapidly. Because if you want investor funding, I think a lot of them are like, we want an ROI, we want that, like, how do we know you're going to become like a unicorn? I think there are all of these like buzzwords, or like, what does an acquisition plan look? And I think there's this general kind of fear that if you are rooted in health equity, that it can exist, but there has to be a high profit margin. And I think that's one of the things that I'm consistently trying to overcome, like even within myself, is to not lose that mission, because I think that myth is quite strong. I think like at large, especially in the US, healthcare is a very like profit oriented machine. Insurance companies are trying to like squeeze you out. They're trying to like double, triple their profits. Hospitals that are nonprofits are not nonprofits, like they are profits. Like CEOs, CFOs are taking in like $8 million in like their salary a year, not to mention bonuses. So I think that that's something that I often find is like the myth that I'm often like have to shift away from, but also like constantly break down in my work. I think especially when you're talking to people, it's like, no, I think people want this. Like it can exist. And also I
Yeah.
think it can like scale and be profitable in a meaningful way.
How do you balance that internally, that struggle between mission uh and your own approach for your business?
I think we live in a really interesting time technologically. And I think that, I was listening to a podcast yesterday, which is The Heart of Healthcare. I really recommend it to anybody who's in healthcare looking to be an entrepreneur, you're interested. There was a recent episode by the YC founders, or the like YC partners rather. For YC is Y Combinator, which is one of those big startup hubs, for anyone who doesn't know. And they were on the episode talking about how I think that AI and health technology is like really changing. And I think that one way to like also be, if the goal is to like is to improve, for example, if the goal is to improve a specialist matching, where, for example, like Hunter wants to see a gastroenterologist, and Hunter wants that gastroenterologist to, for example, I don't know, quote unquote, be queer affirmative. And, I think one of the things that Hunter wants is to be emotionally supported during their doctor's visit. And so think of AI as this triaging machine, or almost like this receptionist. You're streamlining this process, but you're also bringing value. And so I think that's kind of how I like work with that, is like, I think that we aren't necessarily replacing jobs, because I think a lot of the people working in these jobs are underpaid and it doesn't seem streamlined. And so I think that's how I balance it, because if the goal is to improve access to care, reduce that friction, and then help people who are essentially going years and years and years before they see a specialist and seeing the right specialist and are isolated. So I think that you can achieve some sort of a balance then. I think technology allows you to do that.
Yeah. Are there any habits for yourself as a founder? There's so much struggle and challenges that come up every single day as a founder. Is there any habit or routine that keeps you motivated and inspired and on the beam?
Boundaries are so important because I think energy is a limited resource or is a finite resource. And so I don't know a lot about a lot of other people. I have ADHD. And I always joke that when I understood ADHD, I understood myself. And I only have like a reservoir of energy. So I think of myself as a jug of water.
Mm.
And if I'm feeling like, if I'm like, okay, I'm running on empty, you will not hear from me, girl. You won't hear from me. Like, I'm sorry. I'm not going to reply to many messages. And I think I'm very open about that. I'm very much like, this is not the time. This is not Varuna's time right now. I will come out later. Like, so I think that boundaries has been really helpful. Picking and choosing. I think scarcity mindset is so real, especially if you're brown, you're an immigrant, you're living in this country, and you're like, oh my God, I wish I could be like this tech bro who, is just so like killing the game. But it's like, I'm not them.
Yeah.
And I often, like in the beginning of my journey, I was very much like, I have to go here, here, here. I have to meet everybody. And I would have like 7 meetings a day. Now you have to pass a very rigid matrix and like rubric to get into my calendar. And it's not that I'm being difficult. I think that there's, again, only a finite resource, and I want to prioritize where I can show up the most intentionally and like the most authentically. So I think that's really, really what helps me be grounded.
I love that. My first therapist, to bring it around to healthcare,
Yeah.
said to me about boundaries that the creation of boundaries is a loving act,
That it is, isn't
right?
it?
To ourselves and to the people around us.
It truly, it really, really is. And I think if you come from a collectivist culture where, like in India, like they're often like, why did you lock your door? Why aren't you answering? And now I'm just like, think of me as a crab. I'm a crab. Like, but
Gotta
yeah,
go in
I
the
think
shell. Yeah.
exactly. But boundaries are so, yeah, it is a loving act because you don't want irritated and burnt out me. Trust me.
Exactly.
You don't want to deal with that.
Same. And thank you for sharing a bit about your personal experience there. And I see you as a fellow ADHDer who also like I love that you said once you learn about that, you learn what you are, because I wasn't diagnosed until like 4 years ago. And then I was like,
Same.
oh, really? Isn't that interesting? And like, and then I was just like, oh, everything is falling into
Makes
place
sense.
now. No wonder I have mild panic attacks in a grocery store. That doesn't make any sense. I was like, I'm building a company, but I can't find the ketchup and I'm freaking out. What does that mean?
My topic should have been like managing a business as someone who has ADHD or being an ADHD entrepreneur, because that's different. I'm telling you,
It's
it's
different.
different.
But and then I imagine though there are times when it's like the task management when I have my system in place
Yes, you're
is
winning.
awesome. But the thing I have to watch out for, which I heard you alluding to, is the burnout as
Yes,
well.
yes. I mean, we burn out so much faster. And again, it's like this dopamine hit that you're constantly looking for, which I think like with the scarcity mindset thing is like, what's next? Who can I meet next? What's going to make my life exciting? Like you just like are adding too many goals and too many
Yeah.
things to your to-do list. And that's why I always say, like, if you have ADHD, understand ADHD, you will understand yourself. And I feel like that has helped a lot in being like, I can't take that on. It doesn't matter to me. I can't chase that dopamine. It's going to burn me out.
Yeah. And learning how to delegate.
Oh,
When I was starting, yeah, it's really hard, right? Because you're like, oh, it'd be faster if I did it. And you're like, but it's impossible to do everything.
exactly.
Yeah. My first like 6 months to a year building something, I had so many mentors who were like,
Yeah.
how long are you gonna keep doing this yourself there, friend? Like, when
Oh
are you gonna
my
grow your
God.
team? And I think you and I share that you're a start out person. Is that right?
I am.
Me
Yes. Oh my
too.
God. Oh, they are amazing. I always tell them like they have really, really given me the mentor and the guidance. And I feel like of all the startup communities I've been a part of, Start Out has been by far the best.
Yeah. Shout out to Allison. We love you, Allison.
We do. It's
Shout
really
out to
great.
Allison Wright.
Oh my God, this is fun.
Yeah. Oh, I'm glad you think so. This is filling my cup today. Thank you. Thank you.
Yay, I'm glad. I mean, I don't want to make this webinar boring at all. Like I think that a big part of what I'm building is to also not just like share, but I think like humanize it and
Yeah.
just be, you know, we're all doing the thing and we all want to make the world a better place. And it sometimes doesn't, it's not always a straight shot, but you know, we're getting there.
Yeah. Well, thank you so much for making the time today. This was absolutely wonderful.
Yeah, thank you. This was great. Yeah. I'm glad that you guys are putting together this webinar. It's awesome.
Yeah. And how can folks reach out? What's the best way to keep up with what you're doing?
You can follow us on My Fluid Health. And of course, feel free to share my email address if anyone wants to get in touch. Like I mentioned, I'm a manual concierge. Think of me as your concierge. So you want to understand anything about insurance, like what your options are, what specialists that you want to see. Like I want to be that navigator for you. And of course, if you're looking for a queer affirmative sex therapist in New York, we work with some of the best group practices. The app is free to use. You can book a 15-minute appointment. Of course, again, that's free. It's free to sign up, free to book the 15-minute appointment, and we provide emotional support before, during, and after. Anyway, just here to be a resource. You know, we're all in this together. I think from one person to another. Like, again, thank you so much for this opportunity and for honestly trying to make healthcare better for everyone.
Yes, here, here. Well, I look forward to following along, and you can look
Yeah.
forward to my LinkedIn request so I can keep up.
Yes, I will accept.
Okay, thank you. Have a great rest of your day.
Thank you. Bye.
Bye-bye.